The Africa Center for Disease Control press briefing on COVID-19 response is about to start. Let's go there live.
Are going in to make that possible. And of course, it is part of the Partnership for Africa Vaccine Manufacturing. So my name is Wayne Musabayana. I'm Head of Communication at the African Union Commission, and it is my pleasure to be your moderator for the session today. Before I hand over to Dr. John, let me just remind you of the contact details that you will use once we come to that question and answer section. So the WhatsApp number that you will use is +251 94 550 2310. Let me repeat that number. It is +251 94 550 2310. But you can come through live on this platform as well as utilize the question and answer section. All right, now that we have that out of the way, let me now hand you over to Dr. John Nkengasong, and he is the director of the Africa Centers for Disease Control and Prevention. It's over to you, Dr. John.
Thank you, Wayne, and good morning to all the colleagues and media on the platform. And it's a pleasure to interact with you all on this today during our weekly conference, a press briefing. So I would, as always, do three things: give you a breakdown of where we are with respect to the COVID-19 pandemic on the continent, and then discuss some important developments that Wayne touched on, and then, of course, end up with the vaccination and vaccines situation on the continent. So let's start with the epidemiological update. As of today, March 10, 2022, a total of 11.2 million cases of COVID-19 cases have been reported on the continent. And of that amount, that number, about 249,000 people have died. Our case fatality rate is about 2.2%. So the number is edging slowly towards 250,000. We are still experiencing, or many countries are still experiencing the fourth wave and the fifth wave. The situation overall on the continent is driven by the Omicron variant, where 44 countries have now reported the Omicron variant. And one new country last week, Chad, reported the presence of Omicron in the country. 9 member states, and I'll name them, have now reported the BA2 sub-lineage of the Omicron variant. These countries include Botswana, Kenya, Malawi, Mauritius, Rwanda, Senegal, Mozambique, South Africa, and Zambia. In terms of the trends for the last 1 week, and then we'll review those over the last 4 weeks. Overall, let me just make a broad statement that we see an overall positive outlook with respect to the pandemic on the continent, as the evidence and data that I'll read to you will suggest. Between last week and this week, the continent recorded 44,000 new cases of COVID-19. This represents a 24% decrease, average decrease compared to the previous week. If you look at the number of deaths, also during that same period, about 640 new deaths were reported compared to 1,695 the previous week. And this represents a 62% decrease, average decrease from the last week. If we now look at the 4 weeks period, that is the period between 7th February and 6th of March, we observed the following trend: an average decrease of 25% of new cases. And for the first time, we see consistency in decreases in all 5 regions, with 31% decrease in Northern Africa, 27% average decrease in Central Africa, 25% average decrease in East Africa, 13% average decrease in Southern Africa, and 7% average decrease in West Africa. In terms of deaths, in the most populous countries, with the exception of DRC, which recorded a 6% average increase over the last 4 weeks. We have observed a consistent decrease in number of deaths in our most populous countries. This includes 31% average decrease in Ethiopia, 31% average decrease in Nigeria, 29% average decrease in Kenya, 13% average decrease in Egypt, and 11% average decrease in South Africa. In terms of new deaths over the last 4 weeks, the continent reported an average decrease of 22%. And that is all good news. So overall picture looks good for both this week and the last 4 weeks when combined together. The testing, as of last week, between last week and this week, the continent reported a cumulative number of testing that amounted to 1,068,000 to be very specific, and that represents an increase of 18%. The cumulative positivity rate still stands at 11%, and we continue to work with member states to make sure that that number decreases. So in terms of other information, what actions items we are taking. If you recall, immediately after the summit, we did brief you on the outcome of the report that President Ramaphosa presented in his capacity as the COVID champion for the continent. In that report, the head of states endorsed that the continent should engage more and accelerate work in a coordinated fashion to get to a 70% target by the end of the year. As a follow-up of that, today we will be hosting a meeting with the WHO, with ministers of health and all key partners to begin to discuss strategies to improve uptake of vaccines on the continent. And then secondly, how do we foster stronger collaboration and partnership underneath the theme of one country, one plan, so that we can meet the requests, the decisions that the head of states made. So that is an important meeting, and this meeting will be a standing meeting where every month the AU, Africa CDC, and WHO will be working together with other partners. As you heard from Wayne at the start of this press briefing, I was very honored on Monday to be invited by the leadership of Kenya to hop over there to witness a historic signing ceremony between the government of Kenya and Moderna. Moderna is one of the companies that produces the mRNA vaccines. So they did sign an MOU that would enable the production of 500 million doses of vaccines each year in Kenya. And that will be an investment of about $500 million. So again, a historic, I hail that development as a historic engagement in the context of the Partnership for African Vaccine Manufacturing that you are aware we are all promoting. And we started promoting, and it has been endorsed by the Executive Council and the head of states as the platform to coordinate vaccine manufacturing in Africa. Just again, to put this in context, you recall a few weeks ago, I was in Germany, where President Nana Akufo-Addo from Ghana, President Kagame from Rwanda, and President Macky Sall from Senegal were all there working with the BioNTech on a related issue of vaccine manufacturing in those 3 countries. So we are very pleased to see that the movement that we orchestrated in April last year, April 13 and 14, during the COVID vaccine summit that Africa CDC and African Union hosted, is really gaining momentum. I always say that the next time, and I hope there is no next time, we have a pandemic to fight, it will be very different because the continent would have been better armed to produce its own vaccines. That is part of the new public health order that we are preaching, which is a call to order so that the continent can guarantee its own health sovereignty, health security sovereignty, and autonomy to fight infectious diseases and other endemic diseases. In the spirit of boosting vaccine uptake, as I mentioned last week, We are working now very closely with the youth program at the AU to continue to launch a campaign that will place the youth at the center and leadership of mobilizing the continent to vaccinate and get to that 70%, recognizing that 70% of our population on the continent of 1.3 billion people are actually young people. So if they are actively engaged and exercise ownership and leadership of this initiative, we have a good chance that we can get to that level. The importance of vaccinating in excess of 70% of the population is really trying to build up what we call population immunity, which is a combination of those who have been acquired antibodies to the virus by vaccination and those who have been naturally infected. That will give us a high level of antibody at the population level that will begin to help us ease down the restrictions that we are living with. Lastly, as I mentioned before, or we have published before, we now have guidelines for COVID vaccine boosters on the continent, and I invite you to go to our website and see that information. And several countries, I must say, are now on the continent actually engaged in boostering, offering boostering, and there are about 26 of these countries that are already doing vaccine boostering on the continent. And that is a nice segue for me to discuss the vaccine and situation and vaccination. As of today, as of March 9, I beg your pardon, 693 million doses of vaccines have been delivered on the continent. And of that, 431 million doses have been administered. The total number of people that have been fully vaccinated now stands at 12.9%. We see some very good progress in a certain number of countries in terms of vaccinating the eligible population. About 10 member states have vaccinated over 35% of the eligible population. And because it's not a terribly long list, I would beg your indulgence to go through that in recognition also of their great success. Seychelles have vaccinated about 81% of its eligible population, Mauritius 75%, Morocco 62%, Rwanda 60%, Cape Verde 53%, Botswana 49%, Tunisia 39%, Mozambique 37%, Sao Tome and Principe 37%, and Lesotho 36%. In terms of Harvard doses, as of date, Harvard is the African vaccine acquisition task team, has distributed 43.6 million doses of vaccines to 35 member states. And again, this is a process that is ongoing, and we are really pleased to see that progress. Thank you, Wayne, and over to you for the Q&A session.
All right, thank you very much, John. That was Dr. John Nkengasong of the Africa CDC. It is now time for us to go into our question and answer section. And before I give you the first question, let me just remind you of the WhatsApp number to which you can send in your inquiries. And that is +251 94 550 2310. +251 94 550 2310. We also look forward to talking to you live on this platform and to fielding some of your questions on the question and answer section. All right, so let's say good morning to Judith Akolo, who is with the Kenya Broadcasting Corporation. And Judith notes that the positivity rate in Kenya has dropped to below 5% over the past 2 weeks. So her question is it safe for Kenya to drop some of the measures like the wearing of masks, because she has noted that on the streets today.
All right, the Africa Center for Disease Control press briefing on COVID-19 response. And we just heard Dr. John Nkengasong, the director of the Africa CDC just giving the media a briefing on the response on the continent, and he highlighted the importance of young people on the continent to get vaccinated. And the youth department at the African Union, he said, is launching a campaign to get young people on the continent to vaccinate, whom he said amount to about 1.3 billion on the continent, so that we could achieve the 70% inoculation mark.